Morning. This is me in the hospital. I'm feeling a little bit better this morning. It's 5 o'clock in the morning. My phone is on 7%. I'm not able to record a whole blog or vlog, so I'll just have to do a voiceover. This is me in the hospital with COVID at 8 months pregnant.
Hi guys, it's Coco. Welcome to my channel. As you can see based on the title, this is my experience with being COVID positive while being pregnant. And I was 8 months pregnant when I was actually 32 weeks. And also I am vaccinated, so I want to go ahead and let you guys know how my experience was. It all started off with a cough that I had 5 days prior. I noticed the cough, but I didn't think anything of it. I kept saying to myself, we're in flu season, there's germs in the air, people are coughing, so I just have another cough. And I just didn't think much of it. And the coughing at night was worse. I would cough and cough and cough and cough and cough. And I called my doctor. They just told me, hey, you can go ahead and just take Robitussin. So I was taking Robitussin and didn't think nothing of it. But then I realized I started to have something that sounds like wheezing. On the 5th day, I want to say I noticed I was wheezing and a shortness of breath. But I just thought it was okay, part of the cold that I have or the cough. So I didn't think much of it. And I just went about my business. And I remember it was a Friday morning. Got my day going as usual. Got my other 2 kids ready. Took them to school. And then at 11 o'clock, I had to go to work. Went to work. It was a short day for me that day. Got to work at 11. Had lunch around 12:30. And then after lunch, 1:30, I want to say, it just hit me like a ton of bricks. I just felt sudden chills. I put on my jacket. I had a bad headache. My lower back started to hurt me. My feet felt heavy, and I felt like pressure down there. So I'm like, what is going on? And then I felt sleepy too. I felt so sleepy. I'm like, what is going on? But I was like, okay, I'm ready to go. I'm ready to go. So like I said, it was a short day at work. So at 2:20, I got off work. I'm walking to my car. I can barely walk. Co-workers are like, are you okay? I said, yeah, I'm okay. It's just getting closer to my due date. But in reality, I know I'm feeling pressure down there. My feet is so heavy. My back is killing me. I have a headache and I'm just dragging myself to the car. I make it in the car, start the car, back up, drove a little bit, and then I just could not drive because I just was not feeling good. Too much pressure, too much back pain and headache. Called my sister. She said, girl, park your car. I'm coming to get you. I parked my car, and my sister came and picked me up, and she took me to a women's emergency room. This is an emergency room for pregnant women. She took me there, arrived, told them my symptoms, and they was looking at me like, yeah, that sounds like you got COVID. So they went on and checked me, put me in the little triage, checked me, and the first thing they did was go ahead and get a urine sample. Urine sample to check and make sure that it's not a UTI or any infection. Urine sample came back. I'm very dehydrated. So the nurse came back. She was like, okay, that's possible symptom of COVID is dehydration. So instantly they went on and put IV into my arm and put me on some IV fluids to get me back hydrated. And when she finished with that, the next step was to go ahead and give me a COVID test. So they did the test. I believe it was the PCR, if I'm not mistaken. She did let me know that it's going to take about 4 hours to get the results back. So I said, okay. So as I'm waiting on the results, I'm on fluids. I'm on a monitor to monitor my heart rate. The baby's on a monitor to monitor the baby's heart rate. My heart rate is very high. My heart rate was at 125. The baby heart rate was at 173, 175. They was like, Mom, that is super high. Took my temperature. My temperature was high. I had 100 point something temperature. And my back pain was hurting. My head was hurting. So she instantly got me some, what is it, Tylenol. She immediately got me some Tylenol, and I can never say that word. I think it's acetaminophen. It's Tylenol. So she got me Tylenol for that, for the headache, and put me on the IV, put me on a heart monitor to monitor my heart, took my oxygen level to check what's the oxygen level. Baby was high, I was high. My blood pressure was good the whole time, thank God. But all of those signs was a sign of distress. The baby was in distress. That's why the baby heart was so high. And my fever also caused the baby to be so warm. So they was like, yeah, we're going to have to go ahead and keep you right here, keep you hydrated. The nurse kept giving me like juices and water and ice. And I also was on the IV so I can go ahead and get hydrated. So I'm laying there with my blanket. I got the warm blanket, laying there just waiting for the results. And then, like about 4 hours later, they come back and say, Mom, your test is back. You are positive for COVID. And we are going to admit you into the hospital. So I was in triage. They went on and got me a room. They went on and admitted me into the hospital, brought me upstairs. Once I got upstairs, I got a new nurse, and the new nurse just started to do her assessment. Of course, when you get admitted into a hospital, a full assessment needs to be done. So they went on and did a full assessment for me. At that time, the headache started to go away just a little, but it was still there. And I was able to get another dose of pain relief. So she gave me Tylenol again, and then I was still on IV. That IV finished. They put another IV on me and went on and admitted me. My heart rate was still high. Baby heart rate was still high. And fever actually went up higher. So fever went up higher, and they had to call the doctor and they called the doctor and let the doctor know that fever went up. The doctor said, yeah, she's definitely going to stay overnight. So I stayed overnight, and throughout the night, I want to say every 4 hours, the nurse will come. The nurse will check on me, take my vitals, give me whatever medicine was needed. As far as medicine, me being pregnant, what they did, the doctor did allow for me to take was Metamucil for the cough, because I had a bad, nasty cough with mucus, and then Robitussin for all of the coughing. And then they did give me another medicine for cough. I don't remember the name, but it didn't work. It was a small little pill for coughing. It didn't work. And then they kept me on the Tylenol to help with the headache and any other pain that I was feeling. But at that point, the headache had already leave. They was just trying to manage the fever. The back pain was decreasing, and the pressure I was feeling down there, I was no longer feeling it because of the meds. So they did go ahead and prescribe that to me, and I was feeling better. So then by day 2, or the next day, which this picture right here is when I was able to get up out of the bed. I was able to go in the bathroom right there. I was in the bathroom, was able to walk by myself. I no longer had back pain, no longer had a headache. I was able to go in the bathroom, take a shower, freshen up, and eat and do what I needed to do to feel good about myself. That same day, later on the day, the doctor came in. The doctor was like, all your lab works are looking good. Your vitals are looking good. We can send you home, but I don't want you to go home and for the fever to come back. So we would like to keep you for another 24 hours. I told the doctor, well, yeah, I'd rather stay because I don't want to go home and have to come back again. So that's how they end up keeping me for the 2 days, so they can make sure that I was at least 24 hours free without a fever. So in the meantime, IV, lots of water, lots of juice, and blood pressure. Every time they would take my blood pressure, and blood pressure was perfect, then my heart rate started to go down. Baby's heart rate went down, and both of us was at a stable level. And that was pretty much it. Everybody is different. This is my experience. Hopefully your experience won't be as rough. COVID has caused a lot of death, but I also want to let you know that there is hope. Just have faith. Don't panic. If you're feeling those symptoms and it's unbearable, I would say go to the hospital. Not everybody likes going to the hospital, but sometimes you do need medical professionals in your case to help you out. And they really did help me out because they was monitoring me and my baby, because if I stayed home or went straight home after work, I would have never known that my heart rate was so elevated or the baby heart rate was elevated. So the fact I was in the hospital, they was monitoring the baby and they was monitoring me, making sure I don't go into labor, making sure that my body don't go into shock or the baby don't go into shock with all this pain that I was feeling. So it's up to you. Be wise, use your discretion. But me, I did go to the hospital, and I do want to say that I am vaccinated. I got vaccinated 2 months before I was pregnant, and that was the first dose. And then the second dose, I want to say I took it right when I found out I was pregnant. I would think I probably was like 4 weeks or 5 weeks pregnant is when I took the second dose. I was scared, but I called my doctor. My doctor assured me that it was safe and it was actually a smart thing to do to protect my baby by being vaccinated. So I did that. And the ER doctor did inform me that the fact I'm vaccinated, that helped for my symptoms to kind of be less severe. And I truly believe that, because the way I was feeling, I kept thinking to myself, if I'm a vaccinated person and I have all of this pain, imagine someone that's not vaccinated. And I failed to mention, guys, I had shortness of breath and I was wheezing. My shortness of breath wasn't as bad as someone that needed to get on a ventilator, but it was shortness of breath. Some of it had to do with the baby pressing down on my organs, but it also had to do with all of that mucus and that virus being in my respiratory tract. So I was wheezing, I had shortness of breath, I had fever, I had a headache, I had lower back pain, I had pressure down there, ladies, because you're pregnant. I had pressure down there, and all of those were the symptoms that I had. So if you're feeling those symptoms and you're going into panic mode, then you're going to put yourself in at the baby stress level, and that can be where the problem comes in. So I would say go to the hospital and let the professionals do what they need to do. I'm not here to tell anybody get the vaccine, because I know some people are against it, but I'm here to tell you that with me being vaccinated and being with both doses, that helped alleviate some of my symptoms. My symptoms wasn't as severe, but it was enough for me to be hospitalized because of those discomforts that I have or had. So that's pretty much why I made this video, is to let women know that it's okay. As long as you're healthy, it shouldn't be as bad. Your symptoms shouldn't be as bad, and you will make it. You will be okay. Yes, a lot of people have passed away, but everybody's different. Some people have complications, other things, other complications, but you will be okay as long as you make the wise decision that's going to benefit you and your baby. And mine was for me to go to the hospital and get help. After I was day charged on day 2, came home, the doctor did let me know that I'm going to continue to have a cough, which I did have the cough for about 2-3 weeks after I got off. That is part of the symptoms after you have COVID, is a constant cough. At night, the cough is worse. I would cough and cough and cough, but I was able to take Robitussin or Mucinex, which is probably the same thing your doctor will allow you to take. But besides that, there's not really any treatment or any medication that will be given to you while in the hospital for COVID. Just basically you need to stay hydrated. You take your Tylenol and your pain pill, and hopefully you don't have a high fever. Hopefully you can still breathe like I was able to breathe, and hopefully your wheezing is not as bad. So best wishes to you, ladies. Just wanted to make this video out and put it out there because I was looking for a video to see how someone else experience was with COVID being pregnant, and I couldn't find one. So I just made this video to let you guys know I'm 32 weeks pregnant, COVID positive, and also vaccinated. and that was my outcome. So I hope this video helped you guys. Thank you for watching. Please subscribe. Have a blessed day, and stay faith up.
It's 5 o'clock in the morning. My blood pressure is good. Heart rate is down. Fever's gone. Feeling much better. So grateful and blessed to feel so much better. I'm still coughing, but I feel much, 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 much better.